These days, we cannot stress how important research is, especially as we continue to learn more about how COVID-19 spreads, the impact the pandemic has had on physical and mental health, and what role physical activity can play. That's why I've asked Alex, URSA's resident research translator, to help break down what makes a good study, but also how to distinguish between good evidence and evidence that's not so great.
We've been looking at research on the health benefits of exercise for years. We even published a comprehensive narrative review a few years back. And we publish a wee newsletter every month on this Health Benefits of Exercise report. But now we'll be looking at all sorts of research on COVID-19 and gyms.
Kind of like that one CDC study.
Yeah, that was actually a really helpful one that ended up getting misunderstood by a lot of people.
And what about the ones on how exercise may lower your risk of COVID?
There's a few of those, actually. One out of the UK found a link between favorable lifestyle factors and COVID-19 hospitalization. Another one, using genetic markers, found a 5-fold lower risk of respiratory COVID in active people.
Hi, Fergus. So a 5-fold, that's a big difference, but there's also all this stuff about aerosols.
Yep, we had that weird computer modeling one in April that said that you were at greatest risk if you were directly behind someone when they were running, which, does anyone do that unless they're drafted?
No.
I don't know. And then the mask testing one later on, that was debunked that suggested certain types of face coverings could be worse because they would actually re-aerosolize your breath. It's really hard to decipher, especially the aerosol stuff.
Working with Alex, I've come to realize that not all research-based evidence is created equal.
It is not.
Alex does, though, have a few strategies you can use if you're like me to evaluate the strength and quality of research you may see shared around.
There are 4 common types of studies, and they all can provide different insights on the relationship between an intervention, a behavior, or a risk factor, and an outcome. And if you want to learn more about these, be sure to check out November's issue of CBI. But right now, I want to talk to you about 4 factors that can help you identify the strength of a study. I'm talking about having a large sample size, comparison groups, longer follow-up duration, and clearly defined groups, outcomes, and study methods. The first one is the easiest, right? A large sample size provides more accurate results and makes it more likely that researchers will identify any potential differences between groups.
Which is a smooth segue into comparison groups and their presence.
You like that?
I do like that. So why does a comparison group strengthen a study?
Well, they allow researchers to gauge whether the intervention improved outcomes compared to usual care or status quo.
Okay. So kind of like when exercise studies have one group continue to work out as normal and one change frequency to see if it makes a difference, like a control group.
Yes. That's true. A true control group only exists if they were assigned randomly. So if there's not random assignment, if people can, self-select to one group or the other, then it's not a true control group. It's a comparison group.
Interesting. Okay. Fair enough. Learn something new every day. So what about longer follow-up duration?
Yeah, so put simply, longer follow-up durations provide better evidence. Take weight loss studies, for example. One that follows 2 groups for 6 months might show beneficial results in one group over another, but many weight loss studies have found no significant difference between groups once you get, 12 months, 24 months out. So if the goal is to produce long-term weight loss, the longer study gives us a better sense of whether or not the method they used actually worked. Which brings me to the 4th factor. A strong study clearly defines groups, outcomes, study methods. For example, exercise studies should clearly outline the exercise program, the duration, the frequency, the target intensity, as well as attendance and adherence to the program, where the program was conducted, etc.
Now, throughout the COVID-19 pandemic, evidence and research has emerged more quickly and with less review than ever before.
And it's crucial that as the fitness industry continues to talk about all the health benefits of exercise and make the case that fitness facilities are beneficial and lower risk, we rely on quality data to understand when evidence is and isn't high quality.
Yeah, and the great thing is URSA is compiling a lot of this research. We are constantly combing through the latest studies and information and what you need to know, and we compile it and we put it on ursa.org. So if you want studies, if you want to look at good research, Alex does a lot of that for you. Like I said, she is URSA's resident research translator. If we have a question, we ask her. Well, then we also ask Melissa about data.
I mean,
you and Melissa.
Epidemiology research translator, maybe.
If it says $5 health words that I can't pronounce, I go to Alex. Is there a way that people can, like clubs can volunteer to be part of studies?
Yeah, so we're looking at doing some air quality research. We've had some clubs volunteer, but if your club is interested in being part of any type of research, if you know of research going on in your facility and you have results you could share with us, or if you're interested in being involved, reach out.
And if you want quality research sent right to your inbox every month, subscribe to Health Benefits of Exercise Report. That's that newsletter Alex mentioned. And then, of course, do all that social stuff. Like, share, comment on this video. We would really appreciate it.